Johana Alvarez, and today I'm going to talk about suicide and depression. So, did you guys know that every 16 minutes a person commits suicide? And about 30,000 Americans commit suicide per year. And you will get a better understanding of how depression leads to suicide and how you and others can stop it. Okay, so briefly I'm going to talk about the background of depression and suicide, what causes people to go through this, and what's the outcome of depression and what suicide leads to. Okay, so the background of depression, as you guys can see, depression is unhappy and miserable. Like, this could happen with different things. You could have depression for various reasons. And Michael Days, from his background to depression, his article from 2007 says approximately 5% to 7% of the adult population of the United States will suffer from depression during any year. But this number seems small, but when you guys think about it, it's like, what if that person tries to commit suicide during that year? Like, they could end their life in that short period of time. And the background of suicide, that's when somebody's trying to harm or kill themselves for any reason of his or her own. And 2/3 of people who commit suicide are depressed when they attempt this. And I got that number because of DoSomething.org, and they had 11 facts about suicide. And so you don't know what they're doing. Like, they don't know what they're doing when they're depressed. Like, people can't think when they're depressed, so all these emotions build up, and they're not able to think clearly. Okay, so I'm going to talk about background of depression and suicide. I'm going to continue it by talking about the characteristics. So there's 2 changes that they're going to have. It's going to be emotional and behavioral. So they could cry for no reason, like you see Kim Kardashian, she's always crying. You could be frustrated or angry, or you could just lose interest in things that you were very interested in before. You have trouble thinking, you have thoughts of dying, and you like self-criticize yourself. You're very negative towards yourself. For behavioral changes, there's loss of energy, you sleep too little or sleep too much, so you can have like sleep deprivation. And so change of eating habits, aching from your body parts, and self-harm. Okay, so now that I talked about the changes and the background, now I'm going to talk to you guys about what causes people to go through this. So causes of depression, the factors are biological chemistry, hormones, inherited traits, and early childhood trauma. And I got this from mayoclinic.org, and the article was about teen depression in 2012. So biological chemistry is like what's going on in your brain. Like, your brain could play around with you guys. And the hormones is just what your body does. And inherited traits, you could get it from your grandmother or your father. Then you could go through traumas, like she said before about like soldiers and people in the army. That could lead to depression also. And how a person will feel like, they'll feel lonely and inside, like empty inside. They'll feel like if nobody's trying to help them, but sometimes they won't even say it, so you won't know. And they talk about many major psychiatric illnesses include depression, bipolar disorder, and schizophrenia. Often do not manifest themselves until the late teens or early 20s. So they're talking about how college students from Togdi and Thompson from 2013, how this could connect to college students, how they get depressed and they procrastinate a lot with their homework. Okay, so now that I talked about how the characteristics are. I'm going to talk about the outcome of depression and suicide. So, how to prevent suicide? There are medications, psychotherapy, and if it goes to a high degree of depression and trying to harm yourself, you may need to be hospitalized. So I got this from Mayo Clinic as well. And then Al Schur from the journal article Preventing Suicide in 2004. She talks about primary, secondary, and tertiary prevention. And so the first one reduces cases, and it kind of stops it before it actually begins. And the second is to reduce suicide attempts by patients who already tried it, like they already tried to commit suicide. And the third, you go like to a more in depth, and you talk about family, like with your family members, so they could try to help you as well. And what's the outcome of depression continuation? When there's no help, then some medication treatments, they'll cause you to be more aggressive with yourself, and you'll kill yourself like faster than how it already started. So you have to make sure you take the right medication. You can't just get any over-the-counter medication. And it sometimes will not even help a person. And so the conclusion is, it's more important to discuss depression and suicide so you guys can get a better understanding of how to help people, and many people will go through obstacles. So always ask for help if you see any people go through all these characteristics.